to respond in ways that it might not have otherwise. I was in a session just yesterday in Tallinn with the current health minister of Ukraine, with Viktor Lyashko, and he said, there's no way, and we are foolish to think that we can prepare our health systems for crises, and especially not for war. But even he then admitted that some of these 2017 reforms allowed the system to more readily and quickly respond in ways that it might not have otherwise. So our objective today is to reflect on both those things. How has the crisis affected the 2017 reforms in Ukraine? How has it challenged them towards their goal for universal health coverage? But also, how have these reforms allowed Ukraine's health system to be more responsive and reactive to the needs of its population? The event is not a one-off. It's part of one installment of a longer conversation, including initiatives from many of our co-hosts today, Lancet or coming Lancet Commission on Ukraine, also the Universal Health Coverage Commission of Chatham House, a Health Systems Global pre-conference event on Ukraine's health system reforms and also reforms in the wider region. And so I wanted to thank and mention all of our co-hosts briefly before we start. We have, as I said, Chatham House, Health Systems Global, the WHO Observatory on Health Systems and Policies, the President's Fund of Ukraine, the Ukraine and UK Academic Diaspora Network, the Friedrich Naumann Foundation for Freedom in Ukraine, and the Center for Political Studies and Analysis, ADOS. And I'll particularly thank those last few because they're the ones funding the reception after. Finally, a couple of housekeeping notes. As I mentioned, we are recording this. We're going to have two panels. If you have questions, please wait for the moderator to open it up to questions, and we have microphones here for that. Otherwise, I think that's it. So I'll then, without further delay, introduce our keynote speaker, Ulyana. So Ulyana Suprun is former Minister of Health of Ukraine, and she was responsible for implementing the reforms. She moved to Ukraine in 2013 from the United States. So I wanted to warn you that she is American when you hear her accent, but she was made a citizen of Ukraine by Poroshenko because of her contributions to the country and to providing care through her NGO in the eastern region of the country during the war. She now runs a publishing company, but here she is to tell you about the reforms and their impact on Ukraine's resilience. Thank you, Ulyana.
Thanks.
Do you know, I think this is all just...
Yes, I see that
I don't have slides, right?
I don't have slides. I only have my remarks. Thank you very much for inviting me. Thanks for having this session. I think that it's very important for those countries that have been successful in implementing reforms to share their experiences with others. As we were speaking earlier, much of what happens is technical, and we often review the technical aspects of the reform packages. However, we very rarely talk about the politics behind it. And I think that the politics are actually more difficult. And that's something that we're talking about in the Universal Health Commission, and something that we need to refer to. We as physicians or as academics, as people who are involved in this sphere, we often don't want to deal with politics. We think health is above or separate from politics. It is not. It is extremely political, and we need to face that fact. Former chief executive of the NHS, Lord Nigel Crisp, wrote about this, and he said that healthcare is a social and cultural construct. The health system of country is a product of its history, its politics, and its culture, quite as much as it is of its science, education, and its resources. Changing or reforming the health system is therefore just as much a social and cultural movement as a business and management challenge. Lord Crisp is right. Any healthcare system truly is a reflection of a nation's culture. He also wrote that you can't just transport a system from one place to another, but we can certainly learn from each other. And the best elements from various systems can be applied together as long as the culture of the country is ready for that change. In plainer terms, there's really no need to reinvent the bicycle, but you need to have the culture in place so that the people accept the changes that are proposed. I was asked to talk a little bit about what state Ukrainian health culture was in prior to the reforms, why we went through the reforms, what we did, and then a little bit at the end, I'll speak about how that has made Ukraine's health system more resilient. Bear with me. I could speak on this for about 4 or 5 hours, but of course I won't because I know Pavlo has his panel and Ina has her panel afterwards. So I will be describing some of it maybe in more detail and some will be less detailed. If you have any questions, certainly I can answer them later. I will try to stick to my remarks so that I don't get too far off course. In 1991, the Soviet Union collapsed and Ukraine declared independence, inheriting the centrally planned Semashko health system from the Soviet occupation. The system was rigid, inefficient, heavily bureaucratized, corrupt, and poorly funded, receiving less than 3% of the national budget. Most of the funds allocated for healthcare supported the numerous levels of redundant administration and bureaucracy, overabundant infrastructure, and superfluous personnel with low salaries for the health professionals and very little investment in any modernization. 99% of what remained of state financing went into the treatment of disease instead of into prophylaxis. Patients were forced to pay out of pocket for many services, including informal payments to their physicians and for medicines, both inpatient and outpatient. Health outcomes were poor. Life expectancy was 11 years shorter than the European average, and chronic conditions such as cardiovascular disease and diabetes went untreated. An oncology diagnosis could wipe out a family's savings, forcing them to sell their home and borrow money to complete treatment. Although Ukraine's constitution declares that healthcare is free, as populists would have liked to have you believe, concrete rules and guarantees did not exist. Instead, it was based on informal agreements and connections. Corruption in the government's procurement process caused a lack of availability of state-funded medicines and medical devices for patients. They ended up paying out-of-pocket very high prices. Primary care was not well developed. Most patients self-referred to specialists and overused specialized care. Medical education was also poorly financed, and for universities to make ends meet and to allow the rector to accumulate wealth, those of you who are from Ukraine understand that, a degree could be bought rather than earned. Curriculum and instructors were far below European standards. Medical treatment guidelines were antiquated. There was no professional development because skills were not valued. Proof of vaccination for children could be bought and sold from your primary care physician. Over 25 years of reform, from independence until we came into the ministry in 2016, was characterized by legacy system support, and little was done to change social mores, essentially letting a wound fester, leaving in place a mentality that was incongruous with the 21st century. True societal changes began to take shape only after the Revolution of Dignity in 2013 and 2014. A new social contract was proposed between the government and the individual based on shared values, the protection of the rights of all Ukrainians, and adherence to the rule of law. The Euromaidan represented Ukraine's movement away from the Soviet past towards a European future. A number of reforms were initiated in the years following the Euromaidan. The health sector was one of the social services Ukrainians demanded to change, with patient organizations and civil society lobbying the parliament to improve the provision of healthcare for all Ukrainians. In 2014, a special advisory group was formed, uniting the Ministry of Health, civil society, patient organizations, and international experts to propose a roadmap to reform Ukraine's healthcare system. This roadmap was eventually used to implement sweeping reforms beginning in 2016. At the same time, Ukrainians began their journey on the road to reforms. A second crisis compounded the need for change. Russia invaded Ukraine in February 2014, leading to military and civilian injuries and deaths, destruction of health facilities, and internal displacement of over 2 million people who were fleeing the conflict. The financing of social services of those who fled their homes, such as healthcare, remained in the budget of the regions from which they fled. The war strained the already weak health system, overwhelmed by new challenges of shifts in population and demands without any response by the government. Many Ukrainians were forced to pay for care or did not seek care at all. The national budget, which had been ravaged and scavenged by ousted President Yanukovych and his cronies, was struggling to supply the needs of the defense of the country. There was little left to fund the inefficient healthcare system. The system was at a breaking point and something needed to be done. Ukrainians demanded radical changes to the way the system was financed. But as we read in the reports that were in Tallinn this week, many were unwilling to give up the practices such as going directly to specialists, buying medicines without prescriptions, self-hospitalizing for minor illnesses because hospitals were used as social support services rather than healthcare, and expecting all of this to be covered by the national budget. In August of 2016, I was appointed acting Minister of Health of Ukraine by Ukraine's cabinet of ministers. My team of deputy ministers, one of which is going to be speaking today, Pavlo Kovtoniuk, and I developed a strategy for reforming the health system based on recommendations of the Special Advisory Group. Very importantly, what we did was spend several months traveling throughout Ukraine to meet with stakeholders, including the medical community, local governments, patient organizations, hospital administrators, businesses in the healthcare sector to present the proposed changes. We obtained feedback, took these into account if it was improving the strategy, and we were able to have something that was much more reflective of the situation on the ground. We set clear goals and timelines. Each member of the team brought very specific skills and strengths, and their functions and responsibilities were clearly outlined. The key objective of the reforms was to change the guiding principles of the system. First, financing should follow the patient where quality services are provided. Secondly, both patient and the doctor should have the opportunity to choose whether they want to have which physician, where they want to practice, and how they want to get their care. Third, institutions not capable of providing quality services needed to be either reprofiled, reorganized, or closed. And fourth, the taxpayer financing should be transparently distributed throughout the system with clear algorithms, and it must be easy to track. Working alongside a wide coalition of patient and anti-corruption organizations, physicians, public opinion leaders, religious organizations, veterans movements, business associations, and our international partners, the Ministry of Health proposed a law on reform, and on October 19, 2017, Ukraine's parliament passed the law on state financial guarantees for healthcare services, which changed the way healthcare was financed and administered. The new system put the patient's needs in the center of focus. The foundation of the system is primary healthcare. For the first time, Ukrainians are free to choose their primary care physician, not tied to their place of residency. That physician is responsible for the provision of a guaranteed set of services at no cost to the patient, including screening, annual physical exams, lab tests which are performed at the physician's office, vaccinations, treatment of chronic and acute diseases, referrals for specialists, and prescriptions. The physicians sign what we called a declaration with the patient, and the medical records are entered into an e-health or electronic health system. Primary care physicians or practices sign a contract with the National Health Service of Ukraine, NHSU, which was created in 2018 as a single strategic procurer of health services and is funded by the national budget. In the first year, primary care physicians' salaries increased by 200 to 500%, as did the salaries of their nursing and other staff. Pavlo Kovtoniuk, who was Deputy Minister of Health on our team from 2016 through 2019, will be speaking in more detail on the changes made in primary care and how it became the foundation for all of the healthcare reforms. The new system defined a program of medical guarantees, a package of health services according to diagnoses. Financing of specialized and hospital care was changed in 2020, but the rollout was complicated, as much was complicated in that year by the COVID-19 pandemic. The reforms, however, did allow the NHSU to be agile in quickly contracting hospitals to treat COVID patients, creating a new package in the program of medical guarantees. Another program, Accessible Medicines, provided prescription outpatient medicines to patients at no cost or with a small copay for the first time in Ukraine, and it markedly lessened out-of-pocket expenses. moving centralized procurement of medicines, vaccines, and medical devices from within the Ministry of Health to international organizations such as UNICEF, UNDP, Crown Agents, and others, saved over 40%. And it was possible to relocate 6 billion hryvnia, which is the equivalent of $200 million in 2017 alone, out of corrupt officials' reach and allowing for procurement of more medicines. Later, Inna Maslanchuk will describe how this change and the development of a Ukrainian medicines procurement agency have improved access to medicines and decreased corruption and price fixing. Another one of our goals was to improve medical education. We introduced the English language as a requirement for medical students, since the vast majority of research and educational materials are in English. We established minimal requirements to enter medical university. We implemented new testing of medical students and postgraduate educational opportunities for physicians. We expanded nursing education to include master's and PhD level programs and added new professions which had not existed in Ukraine, such as physical and occupational therapy. The decentralization of ownership of medical facilities to local governments increased investments in modernizing the facilities and has improved the quality of care as well as access. One of the most important aspects of healthcare system is trust. A patient's trust of their doctor, the medical professionals' trust they will be supported and allowed to develop their skills in their institutions, an institution's trust in the ability of payers to finance the system, and in the government and regulators to treat them fairly. A politician's trust in the system that their laws and regulations will be implemented and improve the health of their citizens, and the citizens' trust in politicians to understand and incorporate their needs into that healthcare policy. At the time, the system of trust was tenuous in Ukraine. Thus, to start the process of strengthening it, we implemented the opportunity for patients to choose a physician that they trust so that they had that relationship, rather than being assigned to one based on residency. Salaries of the physicians and medical personnel were no longer based on who you know, but on the number of patients you serviced or on the skill levels that you had. The facility signed contracts with the National Health Service of Ukraine, guaranteeing payment. Hence, we named the law on financial guarantees, because that was not present in the past. The last part, which is the trust between politicians and the public, was actually the most difficult. To help with this, we created a communication campaign using social media to educate the public about the reforms, their rights, and the responsibilities of the medical system towards them. We also began a public health education program, debunking Soviet myths about health, explaining medical conditions and their treatment based on scientific evidence, and giving advice on how to maintain a healthy lifestyle, presented in straightforward and sometimes humorous posts on Facebook and other media. My official Facebook page became the most popular and most visited page of all government officials, and unusually was frequently quoted in mass media, and I was actually awarded the most popular blogger in Ukraine in 2018, the Minister of Health. So we had a really good team of young people that prepared our post, and they were quite popular. Russia's hybrid war against Ukraine included massive disinformation campaigns with the aim of undermining trust, again, trust in Ukraine's government, and to increase dissatisfaction and discord. During our tenure at the ministry, healthcare reform was attacked from inside Ukraine by those who in the last year have been arrested as Russian agents, not known to be Russian agents at the time. It also was attacked by Russian propagandist media, the Russian Federation's Ministry of Foreign Affairs, personalities on Russian television, and also on Russian-sponsored media in Ukraine, constantly fear-mongering about the reform, predicting the collapse of Ukraine's medical system, that all of the hospitals will be closed and people will not have access to care. To this day, Russian media claims that reform closed all of the psychiatric hospitals in the country and that the patients are roaming the streets, posing a danger to the public. The reality is that we passed new strategy on mental health, which focused on outpatient psychiatric and psychological care. We also introduced step-down units in psychiatric hospitals to socialize patients who had been institutionalized for almost their entire lives, had never actually been outside of hospitals. We educated primary care physicians in mental health so that they could intervene early, as well as many other changes that happened at the time. Despite these political attacks, personal attacks, our team was able to move this transformation forward. We laid the groundwork for a whole new system of patient-oriented, clearly defined healthcare services being provided for all Ukrainians. Russia's unprovoked attack on Ukraine in February of 2022 has significantly impacted provision of these services, especially in those areas that are under constant missile and ground forces by the Russian military, ground forces assaults by the Russian military, as well as in the recently liberated areas. The National Health Service of Ukraine has continued to function, and that's important because it provides financial support for facilities that are still providing care, allowing them to perform the surgeries, procure medicines and medical supplies, continue to pay salaries. And because they are now agile, they can pay those hospitals that are continuing to practice and move the funding to where it needs to go. The change in financing created conditions by which the government can finance the healthcare facilities that need the funds the most. It's responsive to the needs on the ground. The e-health system makes medical records portable, so patients don't have to worry about physically carrying their paper records. It also helps to collect data. And there was a long discussion about data and how important it is in one of our sessions that we had at Chatham House, which is vital in designing humanitarian aid programs, which will be more effective and reach underserved populations. For instance, data shared with the UNHCR has helped to define that humanitarian medical need aid will be needed for a population consisting of 45% women, 23% children, and 15% of people with disabilities. That's an important thing to know as you plan how you will be providing that aid. Together with the WHO and other donors, the Ministry of Health has organized mobile health units consisting of primary care physicians, pediatricians, gynecologists, and psychologists to ensure that the medical consultations can reach their homes and those who have recently returned to liberated areas where there's very little staff. The system has become much more resilient after the reforms and with the changes implemented in response to Russia's war in Ukraine starting in 2014. However, there are still many challenges facing the system directly related to the full-scale invasion, which happened in February of 2022. These include the destruction of facilities, lack of medical professionals, many have been evacuated or joined the defense of the country, the military. There's been difficulty in resupplying pharmacies and hospitals due to constant attacks by the Russian military and subsequent interruption in the logistics chain, although this last one has been partially solved with the air defense systems now helping to make the resupply routes safer. There are more raw materials available, and Ukrainian pharmaceutical companies, some of which had been destroyed or damaged, their warehouses were completely destroyed. By support from the government and in the international community, they've been able to rebuild and retool, and they're starting production again, producing medicines inside Ukraine. A more insidious problem is to the ongoing reform process is that the war deflects resources into arming the military and later will be needed for reconstruction efforts. On the other hand, the future reconstruction campaign may very well become a driving force for catalyzing more reform, restructuring of the infrastructure, reformatting the system to be more efficient and to be more responsive to patients' needs. A very specific challenge happened with vaccinations. The invasion interrupted a major WHO campaign to vaccinate 100,000 children against polio, because currently the MOH is saying that only 53% of one-year-olds have been vaccinated. It will interfere because of displacement of the children, difficulty in access due to the disruption of the delivery, lack of attention being paid to routine medical care. But schools and mobile vaccination units are attempting to fill this gap, and perhaps Jarno from WHO will be able to speak on that a little bit later when he is on one of the panels. And as we see happening in much of the world, COVID-19 has returned to Ukraine, with over 4,000 cases per week being hospitalized at this point. Provision of healthcare is especially problematic in the temporarily occupied areas. Ukrainians are being forced to take Russian passports to receive care or to obtain medicines. Others aren't receiving any care at all, as reported by humanitarian organizations who have entered soon after liberation and spoken to the healthcare professionals there. As you've likely seen in reports, the Russian military is deliberately targeting civilians and civilian infrastructure, especially ambulances and hospitals. It's not collateral damage. It can't be excused away as there was a military installation there. It's truly targeting of hospitals. According to the WHO, as of December 4th, 2023, 1,666 attacks on medical facilities have been done by the Russians. 112 medical personnel have been killed and another 208 injured. The impact of shelling on humanitarian distribution sites has impeded relief efforts. 6 infrastructure facilities have sustained partial or severe damage, and due to the security situation in areas where there is increased hostilities, the international organizations, are not allowing their aid workers to go into those areas. Now, some of these problems are being partially solved by increasing partnering with local NGOs, but I believe that one of the problems that happened at the very beginning of the full-scale invasion was that all of the NGOs and the diplomatic community abandoned Ukraine. Everybody left the country, and Ukraine was left to be on its own. I can tell you I was in Lviv. I saw the vast amount of people who were trying to get out of the country. And then I was at the Lviv train station, and the only aid that was being given was by the Ukrainian Red Cross, the local Red Cross. The Polish Red Cross came in, and the Ukrainian Emergency Services. There was not a single person from the WHO, from the UNHCR, from any organization that was providing aid. Everybody left because they believed that Ukraine would fall in 3 days and were proved wrong. Currently, there's about 3.6 million internally displaced and 6.2 million globally displaced Ukrainians because of the war. So you can imagine what this how this has decimated the staffing of medical facilities. Many medical personnel were also taken into military service or they volunteered. So surgeons, surgical nurses, EMTs, paramedics, they're no longer at their hospitals, they're serving in the military. Pediatricians and gynecologists have now become combat medics. Nurses have become combat medics. This decreases the availability for the population, of course. The Cabinet of Ministers in January of 2023 issued an order in which medical facilities are designated vital to the community and their medical staff is not conscripted into the military. I think that that is something that will help to provide more services to the underserved communities. This winter is expected to be quite difficult. Most facilities now, after last year's problems and attacks on the energy infrastructure, have generators and supplies of medicines to get them through times where perhaps there will be no power or there won't be any supplies delivered because of attacks by Russian drones and missiles on the infrastructure, whether it be the energy infrastructure or roads. Those are the kinds of things that we've gotten used to in Ukraine. The hum of generators on the street is a natural thing from now. Just today, there were 4 air raid alerts in Kyiv alone. Last night, there was an attack on Odessa and 50 people were injured. This is something that hasn't slowed down and it hasn't stopped. It's still occurring every day, even though the attention might have gone to other parts of the world. As we look back, hindsight is always 20/20, and Ukraine has learned several lessons. One is to be agile so that you can ramp up the hospitals and medical facilities quickly to receive trauma and displaced populations, to finance the facilities, the ones that need it most, to have that agility built into your system. Secondly is to be mobile, to have the ability to provide care anywhere, to ramp up those areas where there are more people, or to take over any building, any facility, and start providing care for the people who need it. Keep your supply chains open. Have multiple supply and logistics chains. Keep your supplies at a maximum so that you are always ready. And make sure that your medical personnel is cross-trained so that you can protect the patients and protect the medical personnel themselves. And also that they'll be able to provide care for communities and not be conscripted. Keep your data accurate and up to date because your ability to respond to a crisis more effectively is very dependent on the data that comes in to you. If it's up to date and you have a good idea of what's going on the ground, you're able to respond better. No one is truly ready for a war or a natural disaster or pandemic. And Ukraine's healthcare system, since the reforms, has become more resilient. We would hope that other countries would never have to go through anything that Ukraine has gone through, anything similar. But we do see that it's happening in other parts of the world on a daily basis. So our advice is to continue to build agility into your system, be mobile, keep your supplies at a maximum, make sure your medical personnel is cross-trained, because we never know what's going to happen in any one of our countries. And those lessons learned should be for the resilience should be beneficial for other countries as well. Whether the crisis that you face is a conflict, a natural disaster, an economic or a political change, or a pandemic. In Ukraine, we've learned to be resilient, and we hope to pass our experience on to those who may need it in the future. Thank you.
Thanks, Ulyana. So as I said, we'll probably save questions. Hopefully, Ulyana, you won't mind being part of the panel discussion afterwards. We'll move directly. There's lots of claps from the online participants and hearts. Okay, we'll move directly to, I see a hand raised online, but we're going to save any questions or comments for the panel discussions, please. We'll move directly to Pavlo Kovtoniuk, who's going to talk more specifically about the reforms in primary healthcare strengthening. Pavlo was, as Ulyana mentioned, the deputy health minister at the time that the 2017 reforms were implemented, and so knows them intimately. We'll move directly from Pavlo to a panel discussion with Pavlo, with Mark Hallowell, who's head of the Global Health Policy Unit at the University of Edinburgh, and has done quite a bit of work with WHO Ukraine on their evaluating their primary healthcare reforms. Also on that panel will be Jarno Habicht, who I'm glad to see has joined us despite cyber attacks on his and other people's cell phones in Ukraine. He'll be joining us from the road. He's the WHO representative in the country office in Ukraine. And that panel will be moderated by Professor Kara Hansen, the Dean of the Faculty of Public Health and Policy at the school, and also somebody who led a commission, the Lancet Commission on Primary Healthcare Strengthening. So Pavlo, if you could just go ahead and unmute yourself. I don't know if you had some slides, so.
Yep. Thank you. Thank you very much for the invitation. Thank you for having me. I was asked to speak about primary care specifically, although I would like to first of all reinforce the message of Ulyana about the political nature of the healthcare system, and I will also completely agree that healthcare systems should not be only been described in the dimension of the technicalities, right, of some technical schemes, constructions, and models, but also under the lens of the politics in the wider sense, or I would say the nation building. And in my short take, I would also like to stress that dimension, because I believe that the primary care in Ukraine is, and most probably will be an important part of the nation building, specifically during the times of the post-war reconstruction. First of all, Ulyana already described the developments in the health reform, and specifically in primary care in the recent years. Before the large-scale reform of 2017-2018, primary care was largely underdeveloped, or in some instances even undeveloped. In the country, the system was totally dominated by the hospital sector. And although some enthusiasts would develop the ideas such as family medicine and so on, hospitals just dominated the system. However, the reform of 2018 and the emergence of the National Health Service of Ukraine gave the powerful boost to the primary health care. Ulyana already described you the a massive response from the people who would go and choose the physicians, and the beginning of the competition between providers for people, and record speed of digitalization of that sector, and first time probably in 70 years, a historic growth of both total and relative income of workforce in primary care, which is also very unusual for the post-Soviet countries. And also that would bring the new generation of doctors and nurses to the top, you know, with more modern views on the medicine at all, not to mention the dynamic development of the private sector and so on and so forth. So that was a huge boost and a large success of the reform. In the subsequent years, it was difficult times. For primary care, first of all, reform had slowed down somewhat. There were important steps which needed to be made at that time, but they weren't made. For example, working with the quality of care rather only with the financial incentives and so on and so forth. But then COVID came, and it was a really tough times for primary care in Ukraine. Although the pressure was really high on primary care physicians and nurses, and there was a high burnout in that profession. However, my impression is that primary care could have had a larger role in tackling the COVID pandemic. Again, the overabundance of hospital sector would lead to domination of hospitals, and primary care was in a very strange position when they were at the point of the first contact, but still the hospitals were the center of the response. I will not go into depth of that, but I would rather switch to the very recent experience, and that is the large-scale invasion of Russian Federation into Ukraine, which happened in 2022. And here the primary care, again, although many problems were in place, it played an immense role in tackling, in refuting this immense challenge in our history. And first of all, primary care was the people who served what they call the Great Ukrainian Migration. There is a time in 2022, about half of the year to 9 months, when 14 million people in Ukraine were on the move, were moving from places they live to other places. Roughly half of them were moving outside of the country as refugees, and another roughly half were moving inside the country as internally displaced persons. And all of them were continuously served by the primary care physicians, both under the formal arrangements and informal arrangements, just by the phone calls, by the text messaging, by arriving of primary care physicians into the cities, for example, in Ukraine, where a lot of IDPs were living, and opening a free volunteer practices just to serve people who were there, either kids or adults. It didn't really matter. So primary care would go together with the population they served and continue to serve them. But also a very important part was the other part of the primary care professionals who would not go with the population, but stay with the population, because many people stayed in a very difficult situations, in a very precarious situations. Some of them under occupation, some of them under the fire. And for example, here on the slide, you can see the very small village of Kyinka in Chernihiv Oblast, where my team went in early 2022 to document the Russian war crimes against healthcare system, which we were doing at that time. And this is the example of how primary care helped this small village near Chernihiv to survive the siege, which lasted for more than 6 weeks in 2022, when the village was completely encircled by Russians, and every day they just barraged this village with cluster munitions. And by the way, these are remnants of the cluster munitions. You know what it is. The cluster munitions are very dangerous weapon which inflicts huge casualties to civilian population. And it is, by the way, it is prohibited by the international law to use near places where civilian people live. And in that circumstances, a nurse who was living there, although two facilities were destroyed, two primary care facilities were destroyed, and the doctor who would come there 2 times per week couldn't reach this place anymore. His nurse would stay with their people and would organize a primary care, a point of care in the school basement. And she continued to provide all possible care she could, including going risky trips into the city to take some medications, sometimes under the shelling, and being back to the village to provide care. So not only primary care would serve people who move, but also primary care would serve people who stay. But today I would draw your attention to the future, not to the past. And I would like to emphasize the role which primary care will most definitely be placed to play in the future. And the primary care would be on the front line of an immense changes Ukrainian society will undergo, especially in its demographic structure and the structure of healthcare needs. There are a couple of facts I want to illustrate, and I want you to know about what kind of profound changes our society would undergo in the following years. First of all, with regard to the population, Ukrainian population is expected to shrink dramatically over the next years. We already were shrinking, as most of the European countries, by the way, before, but the war had largely exacerbated this trend, and it is expected that until 2040, the Ukrainian population will decline to somewhere about 30 million population, maybe 29 million population. Starting with 51, for example, at the year of independence. So the other issue is that Ukrainian population will change in the qualitative terms, not only in quantity, but in quality. So this is a demographic pyramid of the Ukrainian population at the time of independence. You see the 51 million people, a lot of young people, a lot of middle-aged people, quite, less elderly people. If you look at 2040, or like the post-war years, you can see that this population pyramid inverted. So that it will be changed completely. And the primary care would be the people who would actually be at the front line of serving this population. The working age population will shrink a lot. And that's is a trend war-related, of course, but also it is a trend of these processes of migration, because who is migrating the working age population, the economically active populations are the people who move, and they are already migrating, and with future processes like EU accession and so on and so forth, they will continue to migrate. So that means that the people who need care most will stay in the country, the elderly people, the people with chronic conditions, and so on and so forth. And the primary care would be at the front line of that profound demographic shift. Ukrainian population will also face an unprecedented task of rebuilding in the circumstances when the population gets older before it gets rich. For example, if you take the history of the UK after World War II, you will see that the UK population first got rich, right, in the post-war 30 years. And then it started to get older. In Ukraine, it will be vice versa. So Ukrainian population will age. The median age in 2040 will be around 78 years, which is the average for EU today. And economically, Ukraine would still not be even close to the average country of the European Union under the even the most optimistic economic scenarios, which I personally believe in. I think we will develop quite quickly economically after the war, but still, even under those conditions, our let's say health expenditure will reach today's levels of countries like Romania or Bulgaria in 2030. So that would be another profound task Ukrainian health system would face, and primary care especially. Another trend, urbanization, which is inevitable. All the world is being urbanized, but the history shows that in the post-war scenarios, when especially in poor countries, in the lower middle-income countries, people go live in cities. And according to the predictions, the population of the 10 largest agglomerations in Ukraine would constitute 60% of the population, meaning that outside of those big cities, in smaller communities, in rural areas, there will be a lot of people who would need a lot of care. The care consumers, the more elderly population with low mobility. War veterans, mental health, needing physical and mental rehabilitation are the challenges which war brings to Ukraine. And that suggests that Ukrainian healthcare system would undergo the changes even more profound than Uliana described to you. And primary care would be at the very core of those changes, according to my opinion. And I will end with delineating kind of three main directions under which I think the primary care should go to face those profound challenges in the country. One is all of those directions are about expanding the power and ability and capacity of primary care, both in size and in depth. Right, and I would say it should go in three directions. One, in direction of expanding services. So a lot of services must be concentrated from the specialized care level to primary care level, including things like ultrasound, optometry, some basic diagnostic tests, and so on and so forth. The second is bringing the quality of care services, including mental health, rehabilitation, long-term care, and so on and so forth, to the communities where the primary care actually is sometimes the only provider of care. Mental health should also go down to the communities and primary care. I think primary care, especially again in small and medium-sized communities, should become the coordinator of care, and that means again the growing of its role. Moreover, in smaller communities, oftentimes the medical and social services merge. And again, that would need quite a significant effort, and it would pose an interesting task to primary care to actually converge with social services. Now, with regard to the workforce, I think that primary care in Ukraine, on one hand, will inevitably organized around larger group practices, because this is a trend both in technical domain, but also that demographic trends will make us do so. But I still believe that mobile services should be developed to replace the dependence on the stationed facilities in a country like Ukraine, where we have this post-Soviet tradition of having a facility in every rural area. I think that the larger teams in larger communities, plus mobile teams all across the country, reaching the farthest places, the most remote places, is a solution. Also, I think the role of the nurse should be extended a lot, and the community health workers should become a legal profession in Ukraine. It's not the case, but it should become the legal profession, and they should be engaged. And finally, with regard to organization and funding, I think primary care should get, on one hand, greater autonomy, but on the other hand, they should get the power the bargaining power through the mechanisms like PHC-led commissioning, which England, for example, has a vast experience in. And to sum it up, I would say that this list is not exhaustive, right? This is the only things I would quickly delineate it from the top of my head when thinking about the role of primary care. My message is that primary care in Ukraine would again play a huge role in Ukrainian reforms during the post-war period. And although people are tired, people are really under stress, but I do believe it will be successful. And I will end with this picture of a poster with listing the services and the rights of the patients under the program of medical guarantees. That is the National Health Service guarantees, which is actually these posters are in most of the health facilities. And we found this poster in one of the destroyed hospitals in the Sumy Oblast when we were traveling all across those places. And the hospital was totally destroyed, totally, except for one wall. One wall was standing. And on that wall was a poster with the NHSU list of services and patient rights. And somebody would write on it this best wishes to Vladimir Putin, symbolizing what Ukrainians think about the development of their country and of their healthcare system. So I think the primary care would play a huge role in nation building, and this picture is a proof that we are very serious about it. So thank you very much for your attention, and I'm happy to answer the questions.
Thank you so much, Pavlo. What I'm going to do is ask Mark to come and sit here to join our panel. And we've got Joanna Habicht online, and he is, as Adriana said, he's the WHO rep in Ukraine, and Marcus, the University of Edinburgh. And I think I'll call on Joanna first to provide some initial comments, and then Mark to provide some initial comments. And then I've got a few questions that I might ask to you, Pavlo, and then we'll open things up to the audience in the room and possibly to the audience online if I can be helped with that. Adriana, we're running a little bit behind time. How much time do you want to give me for my panel?
20 minutes.
20 minutes, okay. And give me a 5-minute warning.
Yeah. Can you do it on speaker view so that if you're not just speaking, we can see?
We could try that. That's your mouse, isn't it?
Yeah. No, maybe not. Maybe that's
here. Okay, let's try and change. Let's try that. Yeah, do you want to try to start speaking? We'll see if this shifts to you.
Hi, hello. Can you hear me?
Okay, that's great, and we can see you really clearly as well. So thank you very much for that. So over to you to make some initial remarks.
Thank you, and great to be almost in Kiev. And Ulana and Pavlo gave a very good introduction and overview. So difficult to add something, and just to say that coming back from Tallinn. In old time, it took 2 hours. Now it takes 18 hours, but it's still possible. So I think first message that I like to share with the researchers and many colleagues, I think, and what I said also in the summary together with Adriana yesterday in Tallinn, is that when we discuss about Ukraine, let's discuss about that in Ukraine as more often. So this is a call for everybody to come to Ukraine to discuss about Ukraine, learn from Ukraine, and think along as well. I agree very much the aspect that both speakers told about health as part of broader political construct. I think the second aspect is also the trust. And I think what Pavlo was describing, the role of primary care to the community to build that trust and look how the things are moving forward is important. This we have seen particularly in the liberated areas when the doctors who have stayed under the occupation or who have come back to home, that is basically building the trust to the communities to return to build back their home. And what they need is basically basic health services. But the same is the primary care doctors and the mobile teams who are other side of the minefields, providing care for elderly as well, the children who like to stay at home there. So I think primary care plays an important role now, and it will continuously play also in the future, what Pavlo was mentioning as well, Olana. I think there have been a lot of things said. I think few highlights. What is important is data, and that we, even at the time of war, we know what the primary care provides, can we measure, where are the needs, what Ulana was mentioning, but also can we see how the primary care functions. And that's very, very important to also show to the policymakers what the primary care delivers. Because very often in political discussions, we hear much more about the high-level equipment and technologies or some new surgery that has performed instead of 10 people who have been actually getting their hypertensive medicines or ensuring that insulin is available somewhere where it is needed. So I think we need to have the data, show it, but also one of the aspects, what has been discussed in Ukraine, but now in many of the countries, especially in Baltics and so on, is cybersecurity. So I think we need to look to the data, having transparency, but also at the time of war and hybrid wars, we need to look much more to the cybersecurity. So that's one kind of package that we need to look all together. And I must say that as doctors or policymakers, we might not always look to the cybersecurity as much as we need to look. The second aspect, I think where Ukraine is moving, but also is providing services in the front line, where we see that in the liberated areas, every fifth primary care unit had to adjust the package. Also, is we have numerous different modalities of care. So one, what we are pushing very hard is those who are providing humanitarian support, they need to be integrated to the Ukraine health system. What is very, very important and the war goes on since the Russian Federation invasion, and let's be honest, the war goes on since 2014, then I think we need to look that humanitarian support is appreciating and follows the principles of health reforms. And that's why the principles papers, the priority paper, some of the work that we are doing also with Mark and colleagues is extremely important. So that Ukraine doesn't need to adjust to the humanitarian response, but humanitarian response. And we did a survey, we have more than 28 different types of organizations providing mobile health services. They need to ensure that they are aligned to the reform path that Ulana was describing also before. So we need to look to, when we talk about nexus, when we talk about humanitarian response, very often that needs to anchor to the reform of the country, not other way around. So that's another aspect. And the third is, I think we need to build primary care workforce there and give them the skills. I'm also optimistic as Pavlo that the primary care will do more, and we have a group practices, we have teams, but we need to ensure that they have skills. And we have seen now during the war, since the invasion and the full-scale war, from our side, more than 40,000 primary care doctors have been developed more skills in mental health. We know that all of them are now much more able to respond to the CBRN and technological risks. Most of them, they understand much better the mass casualty. They are looking to various other aspects. And I was talking in another country to the primary care doctors. This is not the skills you think about when you are becoming family doctor. So that is another aspect, that while we are training them with all the new skills, we need to be also managing the expectations, what they can provide and how, as well, build the trust of the specialists that they can trust the family doctors, because that is another aspect of trust that we need to ensure. that the cardiologists, the surgeons, the healthcare community, they actually trust the family doctors. So I think a lot to learn. And in addition to the mobile primary care units that Pavlo was thinking, I just want to add one element that Ulana only quickly mentioned, is that we need to look to also the reforms of affordable medicines program, because when we look to the diagnostics, when we look to the labs, when we look to the aging population, we need to ensure also that the medicines are available for the chronic conditions. So because without that, basically the doctors, the patients, and we need to always look from the patient's perspective, they will end up again going to the hospital. So we need to think from patient perspective, how me as a patient, I get all of those aspects from one place, that I can spend less of the time taking care of my chronic disease and invest more to the society, because that's what is ahead in Ukraine. So few of the aspects, thank you for having me. And I think I reached to Kiev, so good to be back.
We're very happy to know that you're safely there. Thank you very much, Jarno, for those additional observations. Let me turn now to Mark, who wanted to also kick off with a few observations.
Yeah, I have a few thoughts which I'll try and fill it so we've got plenty of time for discussion. So I am very obviously British and not Ukrainian, but I've been working with Jarno and the team at the WHO country office in Kyiv in recent years, mostly on questions of health financing. So did some work with Jarno and the team in relation to recovery efforts that are underway. Had the privilege of seeing some of those efforts taking place in some of the areas that have been recovered from Russian military occupation, in which the scale of the damage is extraordinary, is absolute. Villages and towns where pretty much every building is damaged or destroyed, except the primary care clinic, where recovery has already been underway, and recovery has already delivered a functional facility. So that's been very inspiring, but most of my stuff has been on health financing, so I'll focus on that just briefly. And under three themes, I guess. One is resilience, so thinking about the sorts of things that Ulana and Pavlo have been talking about in terms of the reforms that have been introduced and the resilience that they have given rise to. Also, just touching briefly on the nature of recovery, and I think also how those reforms might actually facilitate and accelerate the process of recovery, but also looking at some of the potential challenges that exist at the moment, many of them economic, overlapping with certain political challenges as well, that have the potential, I think, to potentially undermine UHC over the long term. So those are worth reflecting on and considering and trying to head off. Some of these thoughts, I think, are mine. Some of them are not mine. They've been shaped by people in the country office, like Olga Demeshko, also Jarno himself, and indeed Joe Kutzin, who's very interested in working with us on thinking through some of these issues, and indeed writing about them. So as everyone knows, there's a lot of interest in the health system field on this topic of resilience in health systems. What does it look like? What determines it? To what extent can we say Ukraine has demonstrated it? And look, we did a report looking at the recovery process in June. At that point, we were reflecting on the fact that there'd been over 1,000 attacks on healthcare by the Russian military, millions of internally displaced people, millions of people who'd left the country, many of them now coming back. Many human resources, health workers left the country, economic crisis, fiscal crisis brought about by the war, undermining the ability of government to pay for healthcare and also individuals to pay for healthcare, of course, in a context in which out-of-pocket payments continue to be a major proportion of healthcare financing. So, huge challenges. And in response to that, nobody should suggest that the situation is perfect. It's not, clearly. But it seems to us, in terms of the work that we've done around health financing, overlapping into areas of service delivery, of course, including primary healthcare, that the conditions have been put in place through the 2017 reforms, through the work that Ulana and Pavlo and others did, has introduced a momentum behind UHC. And as a consequence of that, has allowed the health system to demonstrate a huge amount of resilience. And from a health financing point of view, it's kind of interesting and instructive to try and understand what the key dimensions of that might be. So there are things like, non-contributory entitlements, very important in a context of economic disruption caused by the war, consolidation of what might have been at one time quite fragmented resources into this single pot, the Programme of Medical Guarantees, the establishment of the National Health Service of Ukraine, as the sort of the pillar of the single payer structure which has been introduced. I think as well, explicit prioritization of PHC in the budget has been incredibly important, alongside financial reforms in terms of the shift to capitation payments. There's been flexibility around that, so there's been moments in time when they've moved more to global budgets, but now switching back to capitation, and that's meant that those things actually they sound very niche and they sound very technical, but they really matter. And the vast majority of PHC facilities have managed to continue paying salaries to health workers. And they've managed to continue to provide comprehensive continuous care at a point in time where health needs are changing and where there's a huge amount of demographic change, people moving around the country, people leaving the country and coming back. So resilience, extraordinary story to tell there. In terms of the recovery, again, the reforms have, I think, placed the health system in a relatively good place in terms of the ability to accelerate the process of recovery on very specific things. And we saw some of this in in those reclaimed territories, the recently liberated territories where recovery is underway. NGOs and others and government, they're investing in primary care facilities. And we know that there's a guaranteed revenue stream to support the recurrent costs of those facilities going forward. That's provided by the NHSU. Going to some of the issues that Pavlo mentioned just now, I mean, a lot of talk in the resilience literature and on health emergencies literature about building back better. And in Ukraine, I think I want to say that, this is not just an aspiration at this point, it's really an imperative, because there is an economic crisis brought about by the Russian full-scale invasion. And there is obviously impact of that on fiscal space. A huge amount of government of Ukraine revenue goes towards the military, very understandably. That means a huge part of the health budget is financed through external resources. I think going forward, as Pavlo was indicating, there really needs to be an intensification of this reform process that's been taking place. And a continued expansion of primary care, continued consolidation of some of the other levels of care where there is a degree of inefficiency and a degree of excess capacity. And it feels to me a little bit like at the moment, it'd be interesting to see if others agree, that the healthcare system is a bit of a crossroads. The country can go kind of all in on intensification of these reforms and deepening of these reforms, or it could fail to do that. And it could, in the context of this fiscal situation, move to a more privately financed model. And there are some signs that there are political interests within the country that are interested in taking that route. And it'll be interesting to see how those economic stroke political discussions play out. But there's a hugely positive story to tell about UHC. I think there are some serious headwinds around that in terms of the economic crisis, in terms of potential enthusiasm in parts of the country to do things which may to some degree undermine UHC. And I think that it is very important to say that for the international community, there is this amazing story that we can, that can be told. There is a momentum behind UHC, and now there needs to be a level of support in, financial terms, in technical terms, in many other terms, that's going to allow the country to sustain that and even expand that in the future.
Super. Thanks very much, Mark. Do you think we have time for a question or two? I want to jump in as well, just because I think this is such an interesting story. And as Adriana said, I chaired the Lancet Commission on Financing Primary Healthcare that published about 18 months ago. And in reading about the Ukrainian reforms of 2017, there's so such an exemplary case of the guidance that we provided and the principles that we provided in terms of capitation payment as a way of creating flexibility and stability in the system, and also putting people at the center, not just of the care system, but also of the financing system. And that was such a strong theme of our work. But also just listening also to Pavlo and to Ilana talking about the need for technical strategies to be politically informed. And I guess just Mark, picking up on what you said, there's a moment now where it's necessary to stay the course, and there's all kinds to continue to make the progress that is for which the foundations were built in 2017 amidst a whole bunch of other forces, and that while it may be very clear what the right technical path is, I think navigating the political forces will be particularly challenging. So we have about 5 minutes. Are there any questions for our speakers? We have time to take maybe 2 questions and to go back to the panel. Okay, any hands in the room? Okay, there's one back there. I'm going to run with a mic. Can you pass me a mic, Adriana? Okay, you can run. Even better. I turn it on as well. So 2 questions on this side. We'll take these 2 and then see where we are for time. And if you could introduce yourself and maybe say if you're directing your question towards everyone or just towards one person. We'll take both. Oh, sorry. We'll take the questions together and then we'll ask the panelists to respond. And to press the button until it turns green.
Hello.
Yeah,
okay.
got you.
My name's Aparna. I did my master's here at LSHTM last year. I had a question for the very first panelist, but I figure someone could speak to us in general. I heard you speak about how medication procurement was done through international agencies. And I don't know if I misheard you, but I was wondering why that was kind of shifted over via like the UN and the WHO and such instead of solely based in Ukraine, and if that was kind of sustainable or if that's more transition until it's like directed.
Okay. And let me ask, is that a question that's going to be picked up in the second half? Is that okay? So maybe we'll hold that the whole second half is going to address that question of the different institutional arrangements around medicines procurement.
There's somebody here with a raised hand. Anita, I'll just.
Okay, Anita, you are unmuted. Just to ask you a question.
It's quite a while ago, so I'm not sure.
Just to note that we still have almost 70 people online, so it's a fantastic showing here. Okay, we're having problems getting Anita, so please you go ahead with the mic there.
Hello, I'm Olena Nizalova. I'm a researcher from University of Kent, and I have been following the reforms and studying them as well. And given what Ulana said about the politics of healthcare reforms, I wonder what you think enabled your team to get through. You know, what you did, or maybe circumstances, how they arranged that allowed you to plow through. And it's to you and to Pavlo, because you worked in a team.
Thank you. So let me ask Pavlo to respond to that. I've heard part of it. I think I heard Ilana speak about this in Bogota, and I have to say it's an amazing story. So Pavlo, please go ahead and tell us about that management. You know, how did you manage the political forces in order to enable you to generate those reforms?
Yeah, thanks, and hello, Elena. And I think that the question about about managing the political forces is more to Ulana than me, because what we had is the synergy of very powerful political leadership, which Ulana was responsible for, and very strong technical support, which I was responsible for, and supported by lots of experts, including WHO experts and World Bank experts and the USAID experts and whatever expert you can imagine. And my point would be that once you have a very strong political will and articulated agenda, which you are very serious about imposing, suddenly and miraculously, you know, many partners, many helpers, many other organizations, international governments will suddenly emerge and offer you help, and you know, and you will have a lot of actually resources emerging from nowhere. So I would say that this I'm insisting that politics is primary. You need a strong political commitment and leadership, empowered by the technical agenda, and then everything else you will get it.
All right. Thanks very much, Pablo. I think I will draw this part to a close because we do have another exciting program. But just I think that that setting of the scene in terms of the the 2017 reforms, the way in which those reforms have enabled and fostered resilience in the system, that driving of new delivery models to respond to crisis, the maintaining of the primary healthcare infrastructure, partly that's because of the strength of the design of the reforms in 2017. And I think then going forward, this challenge of how to sustain those, how to stay the course in a post-conflict setting where you'll be very fiscally challenged and yet still have something to show for I think you've got a very powerful political example from the way that the reforms have enabled the resilience under the current conflict and conditions. I think it gives everyone in the room lots of hope that that those challenges will be ones that will be managed well in Ukraine. So thank you all very much. And I'm going to turn over to Nina online. Okay, so Adriana will introduce.
Okay, thank you. Ina, are you there?
Yes, Adriana.
Hi, Ina. Okay. Okay, yeah. All right. So great. So we've got about 15 minutes for Ina, and then another panel of about 20 minutes, and still time for Rob to wrap up. So we're okay. Ina is joining us also from Kyiv. She is currently head of health system integration and client success management at Zipline. I don't know if everybody's familiar with that with the Zipline, but you can explain it if you have a moment later. Before that, she was a health system expert, particularly focusing on access to medicines during the time of the 2017 reforms, and so knows very well specifically the reforms to rid the pharmaceutical system of corruption. So with that, I'll leave it to Ina, and then we'll go directly to the panel. They'll be moderated by Dina Balabanova, who is professor of health systems at the London School of Hygiene and Tropical Medicine, and Martin McKee, professor of European Public Health at the London School. And we also have Gillian Kohler from University of Toronto. Gillian, are you online? Also professor at Dana Lana School of Public Health. Okay, great. Thank you very much. Thanks.
Yeah, thank you, Adriana. Thank you, dear audience, and good evening all. And first of all, thank you so much for having me and also inviting me for this important event. And thank you so much for your interest in Ukraine, ongoing interest, and thank you for the opportunity to talk about the reforms in Ukraine, which was happened in the recent years. And then a few words about my current position in Zipline Ukraine. Zipline is actually drone delivery service of vaccines, blood components, and also some medical products. And we are currently launching this service in Ukraine. Yeah, and I have listened to the previous speakers, and I was honored to work with them, with Dr. Ilana Suprun, with Pavlo Kovtunuk in the Ministry of Health team, and it was a great pleasure for me. And I must say that the access to life-saving medicines has always been a crucial part of general healthcare reform in Ukraine. And so let me briefly present you some achievements of Ukrainian government, and in the collaboration with the foreign partners in anti-corruption reforms in medical procurement in Ukraine. So first of all, it was to mention that the challenges which occurred in the significant shift in the procurement of medical products in Ukraine. It also was to mention that before 2015, most of the distributors participated in the tenders leading by the Ministry of Health of Ukraine. And for example, in the programs, if we are talking about the adult or children oncology programs, and procurement medicine for these patients. Almost 97% of distributors were participated in these tenders. Yeah, and Ukrainian distributors, actually, it's a not classical distribution companies operating, for example, in the UK, in the US or EU. For years, Ukrainian distributors would win the bulk of the tenders and leaving domestic manufacturers only 6% of this market. And actually, it was served like as a type of corruption breach between the pharmaceutical companies, manufacturers, and between some civil servants in the Ministry of Health. And as the information, according to the information provided by the State Security Service of Ukraine, actually, this cooperation resulted in up to 40% overspending of state budget allocated on the procurement of medicines. And foreign manufacturers, actually, in most cases, they ignored the procurement procedures in Ukraine before 2015. And actually, it was a huge part of the challenges and the huge corruption in this area. And in most cases, it was a sustainable monopoly on the market of some precise distributors in Ukraine. And also, if we are talking about the distributors' participation in the tenders, it's about the high price for procured items. And also, if we are talking about the limited budget allocated for procurement of medicines and the high price for medicines, we are talking about the lowest number of patients which receiving of life-saving medicines. And yeah, actually, taking into the account of these challenges and due to the political reasons, and as Ulan mentioned, in 2014, a revolution of dignity happened in Ukraine. In 2015, government of Ukraine adopted the law and actually transferred the central level procurement for specialized international organization. It was a Crown Agents organization in the UK located, but they have an office in Ukraine. It's a UNDP and UNICEF. And actually, between 2015 and 2018, MOH contracted this specialized organization, and the total amount of the budget allocated to them was approximately $670 million. And this way, the Ministry of Health of Ukraine actually got some time needed to reform the management of healthcare financing, and in particular public procurement, because as Dr. Ulana mentioned, that the healthcare reform, healthcare transformation happened in that years. And actually this time would allow providing patients with effective quality and safe medicines and medical devices. And actually, it was to mention that for the effective procurement by this outsourced international organization, government of Ukraine created a specific legislative conditions for these procurement agencies. First of all, it's a fast-track registration of the medicines. Within 7 days, it's a value-added VAT exemption for them and the labeling simplification. And actually, what about the achievement of this outsourced procurement? Such a decision of government of Ukraine to trust the procurements on international partners, it was a temporary, as I mentioned before. But at the same time, it is difficult to overestimate the effectiveness of the decision. But according to the 2018 report of the Accounting Chamber of Ukraine, this led to savings almost 14% in the first years of the implementation of this reform. And actually up to 70% of drugs have been procured directly from the manufacturers. Actually, it opened the doors for them in the government procurement. And actually, the savings were gained under almost 23 treatment programs within the government procurement. And yeah, the almost that 57 new medicines have been registered, and 8 of them it's vaccines, which are crucial for for the government. And actually, we know that some cases of the outsourced procurement experience has been adopted by in other countries. For example, we heard about the Bosnia and Herzegovina, Kazakhstan, Turkmenistan, and Uzbekistan. Most of them, it's a post-Soviet Union countries, as you know. Yeah, and given the temporary nature of this transfer of procurement from the Ministry of Health to international partners, we should understand that Ministry of Health still had some challenges, even in the interaction with them. And all in the ministry and also in the ecosystem of partners, Ministry of Health had the urgent need to implement its own effective mechanisms to procure medicines efficiently. And yeah, it was a lack of unified approach to VAT exemptions. Some delays in funds transfers also happened because in Ukraine, we still don't have the long-term budget planning. And the long process of engaging the Ministry of Health, because still, even in the interaction of them with them international partners which procure the medicines, all documents, all orders was under the Ministry of Health on their side. And actually, it also occurs some interruptions in supply chain and monopolization of logistics, state-owned enterprise and under the Ministry of Health. And it's also crucial to mention that on that time in 2018 and 2019, all public procurement procedures were to be carried exclusively on the ProZorro online platform. And this international organization, they didn't procure in the ProZorro online platform. And that's why some international partners, they mentioned that, okay, we should be more transparent in the public procurement. So yeah, taking into the account these mentioned challenges, Government of Ukraine in 2018 adopted some concept on the procurement reform, and the crucial point in this concept was the launch of the state-owned enterprise medical procurement of Ukraine. On the other hand, MOH Ukraine also established the working group on the support of this reforming. And under the scope of work of this working group was also to develop the concept of legislative change for the effective functioning of the state-owned enterprise. And in this working group was very engaged a lot of stakeholders, for example, patients organizations, business associations, also the donors. And actually the huge support we got from the USAID. And it was under this working group scope of work, as I mentioned, was the development of this roadmap of legislative changes, and following the establishment of this state-owned enterprise medical procurement of Ukraine, it was required towards a separated law of Ukraine. And some briefly, I will present you some crucial this change which was occurred and was mentioned in this separated law. First of all, it's an ability to make this direct contracts with foreign manufacturers, the right to choose the service providers. First of all, it's about logistics. Fast track registration, it actually was transferred from the international organizations changed, and delivery of medicines, the ability to deliver medicines in a foreign language with the provision of translation into Ukrainian, exemption from state quality control when we are talking about the import, exemption of medicines and medical products from the state price regulation, and exemption from VAT still, possibility of long-term contracts, and the right to purchase medicines even not registered in Ukraine in some rare cases, if we are talking about, for example, the rape disease. And of course, we should understand that this law, which I'm talking about, it was produced with a huge support of the donors, of the foreign partners, and we should understand that these changes were crucial for the Ukrainian government, for the patients of Ukraine, because in most cases the prices offered by state-owned enterprise medical procurement of Ukraine was on 40 or 50% lower than the prices which were provided in comparison with international organizations. And some brilliant case, it's a procurement of life-saving therapy for the women with the breast cancer. It's a trastuzumab INN. It was a significant price reduction during the tenders led by the medical procurement of Ukraine, and the average price was almost 10 times lower than the average price procurement price by specialized organization in 2018, and this allowed to cover all women with the breast cancer in Ukraine with this therapy. And of course, we should understand that another outcomes also which are crucial for Ukraine is that even despite the full-scale war in Ukraine, medical procurement of Ukraine continued to maintain these procurements of life-saving therapy for Ukrainian guardians, and also even to launch the new reforms. For example, the hospital procurement area. They launched the e-catalogs project. It's online market for hospitals. And actually it also allowed to reduce the prices and to save a lot of budget funding for some hospitals. And some brilliant also example of the resilience of medical procurement and sphere in Ukraine, the state-owned enterprise, they also procure under the president's program United 24. And thank you so much for all of you if you donated the money for Ukraine under this program or another programs. And medical procurement of Ukraine, actually, they procure the ambulance cars with a significant diminution of the prices, and also the cars for the battlefield for our soldiers, and also the generators for the hospitals in Ukraine during for the resilience during the blackout. So we can definitely say that this reform medical procurement of Ukraine and this state-owned enterprise became the change maker, not only on the government level, but also for the hospital procurement area. And it still supports hugely the healthcare in terms of the access of life-saving therapy for patients in Ukraine. Yeah, thank you for your attention. Yeah, and I would love to hear your questions or comments as well.
Thank you very much, Ina. This was brilliant. And I would like to invite our panelist, Martin. So just before we start, I wanted to just tell you that before the war, before everybody watched the news about Ukraine, everybody and a lot of our partners knew about this initiative in Ukraine. It's known to be extremely successful, and a lot of countries have sought to replicate and to really learn what can be done and how it could be done. It was extremely successful in terms of reducing the prices of drugs, essential drugs, and ensuring availability, addressing some state capture issues. So what I'm going to ask every panelist a different question so we can have a discussion, but Ina and others, I would love to learn more what everybody is asking. how is this reform done? How is it possible? So I think this is the key question. So, but first, I would like to start with Gillian Keller. Martin, you could sit here, so you're next. Maybe Gillian, are you online?
I'm here. Hi, Dina. Thank you for inviting me.
Hi. So Gillian has worked for many years heading a center on preventing corruption in procurement. And I would like to say before we continue that procurement is one of the areas where we see most corruption. And we know that estimates are showing that corruption in health systems sometimes accounts for, some argue 30% or 40%, but I think it's about 30% of health expenditure is lost to corruption. And procurement constitutes this big chunk. But I would like to ask you, Gillian, to comment to what extent addressing corruption in the procurement area is something that takes us to accelerate UHC, progress to UHC.
Thank you, Dina. It's a really important question, and I'll speak generally because I'm not an expert on Ukraine, and there are others here who will speak to that. But just in terms of general anti-corruption initiatives, as Dina mentioned, procurement in the best of times is the area that governments experience the highest levels of corruption, particularly when it comes to the health sector. So if, again, as Ina mentioned, and an area that I work on, access to medicines is critical for health as a human right and obviously for UHC. And given that drugs are usually a very high price item, they need to be procured frequently. If we want to achieve UHC, we need to make sure we have good procurement systems in place. We also need to see, speaking just more generally about what happened during the COVID pandemic, that in times of emergency, whether it's a crisis like war, which we've been speaking about today, or whether it's a public health emergency, that when procurement needs to be done quickly, it's done well, and it's done with anti-corruption, transparency, and accountability mechanisms in place. And the Ukraine experience, again, I won't speak to, but there are some key points that have been emphasized. One is essentially ensuring there is transparency, but as well as accountability in the procurement process. So for that, there is the open contract data standard, which is really important. What does that mean? It discloses data and documents at all stages of contracting process. What's also very important as well is e-procurement, where you can have digitization, which allows for electronic bidding and tendering. And what's also critical is when there is a crisis going on, when you have online information systems working, citizens ideally would have access to this information and would be able to monitor what the government is doing, how, why, and what. And I know that we're short for time, so I'll stop here in a moment. But what I would also say, what's really critical for procurement is that there is auditing, there is specialized auditing, there is reporting, as well as integrity packs in place. So whoever is participating in the process acknowledges the need for best practices. I'll hold off there, Dina.
Thank you very much. So I would like to turn to Martin. So Martin, you did a report on the European Union looking at all the types of fraud and different types of abuses of corruption during COVID. And it was incredible. And we read the news every day. So that's what's interesting for me. I would like to ask you why this is the case. We have health systems that have good governance. They have rules. These are quite well-established systems, and suddenly there is a crisis and there is breakdown. There are these possibility spaces where all these cases of PPE abuses and vested interests occur. So why is this happening?
Well, because we elect criminals. Quite simply. Shall I go on?
It's not just UK. In your report, you talked about Belgium, Netherlands. So.
But yeah, I mean, in fairness, although the UK left the EU, we did have to work quite hard in that report to make sure that all of the examples of corruption didn't come from the UK, but a lot of them did, and there were examples elsewhere. But we did have a major problem in this country. The problem is that under the EU directive, there are which applied in the UK at the time, which still does actually, as retained law, as inherited law, there are provisions for procurement in emergencies, and the provisions are there. They should be used. It was just that the UK decided not to use them. And of course, we all accept that there was a degree of panic at the beginning, but that was not really a reason to depart from the rules. They could have easily been applied. And of course, it wasn't particularly helped in the UK by the fact that, and it took a little while, it's fair to say, the other European countries, the EU countries, did work together. After the initial problems, we of course didn't. So I think that is something to do. I think the points that have been made, we need transparency. We still don't have transparency about what happened. We will hopefully get to it in a later module in the COVID inquiry. But we now have Baroness Mohn, who has conceded that she does have family links to the company that inherited all that got all of that money.
But I think you were mentioning once interesting case of they contracted a company to ship essential drugs during the early stages of the pandemic, and this company doesn't own ships. It's not
the difficulty was that you do due diligence when you're contracting with anybody, and you make sure that the company you're contracting with has money in the bank, well, more than £100 in the bank, for example. I mean, if you're giving somebody £100 million contract, you want to make sure that it was set up more than 3 months ago and has more than £100 in the bank. That's sort of good practice. We didn't.
Why?
Precisely, we didn't. Again, I think we have to wait for the inquiry. But you had other ones where you went to a jewelry retailer in Florida, and again, £1 million contracts. A lingerie entrepreneur we've already mentioned.
But what I wanted to ask you is that there is a health service with structures to do this governance, to do this dealing. So are you saying that the politicians, the political structures overrode that?
Yeah, I am.
And how is this possible?
Sorry, Dina, you've lived in the UK for a long time. So why is this possible? I mean, other people can comment on that, but essentially you have sorry, I don't want to talk too much about the UK because this is about Ukraine, but the reality of it is that when you have a government that is willing to break international law explicitly, whenever it is willing to remove the courts from their role in scrutinizing legislation, is it any surprise that whenever there is a crisis, it tears up the rules? So I maybe just leave it at that, because I think this makes the point that the rule of law is incredibly important, and the rule of law is upheld by the courts. And once you start to write the courts out of scrutinizing the rule of law, this is what happens. And what happens is that in this country, health workers died because they could not get PPE, because the money had been spent on friends of politicians. They have blood on their hands, quite simply.
And I think this is, we know how difficult it is. We know in some countries in sub-Saharan Africa, trying to fix this issue. People were attacked, people were shot. So it's quite, so I would like to ask Ina. Yes. So I was just wondering about the political economy of this reform that you did. Who supported that? How is this possible? Because we know there is a lot of state capture, and you talked about corruption before the reform, before the first stage, the contracting out. So how is this even possible? Because we know every country that tries to do something like that, and a lot of countries have tried to emulate, immediately there are companies standing up, there are coalitions, there are networks that really prevent. So what do you think made it possible?
Yeah, thank you for this question. It's really important to mention. And I totally agree with the words of Dr. Ullana Suprun. She mentioned that in most cases, healthcare reforms, it's about the politics, unfortunately. And in the case of public procurement reform in Ukraine, yes, we had a strong support of Prime Minister and the healthcare committee in the parliament of Ukraine. If we are talking about the voting the law and about the voting for these changes, which is crucial for the efficient procurement of medicines. And yeah, first of all, it's a strong political will and a strong support of donors organizations. We are talking mostly about the support of USAID in Ukraine. and also the Embassy of the United States in Ukraine, and WHO in Ukraine, World Bank, all these, financial organizations which still support Ukraine, because we need more support. We need to be more resilient. But on the other hand, all of these organizations, they require the reforms in Ukraine. And that's why they invested a lot in public procurement of medicines and public procurement reform in Ukraine, because they actually knew that it's crucial for the budget savings, for the coverage, the more range coverage of our patients by the life-saving therapy.
But of course, but please come. But I also would like to ask you to also add about, I read online a lot about that another factor, apart from what you're saying, was the civil society, pressure from the civil society.
Yes, and what I wanted to add to what Ina was saying, first of all, you said that in many countries, people get attacked and either politically or physically, and it happened in Ukraine as well. It was horrific. That was one of the hardest things that we went through, it really was. And what a problem was that many of the leading physicians that were respected in Ukraine were the ones that were committing this corruption. They were the ones that were putting the money in their pocket. They have the ears of the politicians because those are their physicians. So the vast majority of politicians were against what we were doing because we were taking money out of the pockets of the physicians who have their ear. That trust part was turned around in a very negative way. Civil society was key, more key than any politician was. There's an organization called 100% Life. It's an organization that is a network of people who live with HIV, the strongest and most active patient organization in Ukraine. At one point, they organized protests in 35 cities across Ukraine simultaneously to make sure that the law was getting passed, that nothing was changing in the law, and they were key in getting much of this done. When I came into the ministry, the law was passed in 2015, I came in 2016. Before we reformed the ministry itself, there was quite a bit of corruption inside the ministry, and it was slowing down the process. When I came in, literally the first day I came in, I walked into a table with piled high documents like this on the table of medicines that were waiting for the signature of the minister to be able to go through customs, to be able to be brought to patients. We had a department that was taking care of this, all the procurement for all of Ukraine, 3 people, 2 of which were on maternity leave and 1 of which quit the day I came in. That's how we started that procurement. It took us Olha Stefanishina, who's now a member of parliament, who was a deputy minister after a while, was the head of the Patients of Ukraine. She actually brought in Ina and several people from her organization who sat there, not civil servants, to go through the paperwork and help us to get this signed. I thought my hand was going to fall off after the first week I was at the ministry. I never signed my name so many times. And you know how doctors write, so you barely recognize my signature. So this was probably the hardest thing that we went through, but it was well worth it. The first step was to take procurement out of the ministry and out of the corrupt hands of those people making money off of it and give it to the international organizations. The next step was to create our own organization to do the procurement inside Ukraine. And what we were thrilled with was that the international organizations actually procured from Ukrainian pharmaceutical companies as well. So we were not only supporting patients by having them get medicines, but supporting business in Ukraine and the Ukrainian budget. So we were quite thrilled. It was a very, very positive change that happened. And while we were in the ministry, we were able to cover 100% of children's oncology, 100% of breast cancer oncology patients, 100% of our patients with rare diseases. So we really improved quite a bit of what we could do.
But if I may, I mean, on that, then with your agreement with the international organizations, you need to make sure that then they do procure locally, because one of the problems is that when you go to these organizations, the easy thing to do, go to the manufacturers, go to somebody else, and they keep the transaction costs for them as low as possible. But procurement is much more than just getting things. Procurement is about development and creation of a market and all sorts of other things. And we missed that. It's so easy to take the short-term approach, which is why I can't remember there's some musician, and forgive me, some of you will know the example, but he insisted in always having had in his caravans the M&Ms, the sweets, but none of the brown ones in it. And it wasn't that he had anything against brown M&Ms, but it was essentially saying that if I'm going to deal with roadies and various other ones, I want somebody who is actually not one of the really big companies that will not read the contract, but somebody local, and that will actually develop and support the local community in which he was playing in. So you need to think in procurement that it is not just about getting the cheapest offer, but it is actually getting money back into Ukraine as you did that. And that requires a degree of, thinking through that.
Well, there were a lot of companies a lot of pharmaceutical manufacturers that were never basically allowed into the tendering process because there was price fixation between a small group of companies that were owned by several members of parliament, as well as Russian.
What was the reaction of these groups? That's my key question that you said.
The reaction of the groups were horrific political attacks on us. Me personally, our team, as well as the government and the president of Ukraine, and actual physical attacks in several cases on our team, as well as our family members. It was quite ugly. It was very ugly. And after a while, people got used to the medicines being procured by the international organizations. And when we took over our own procurement, we actually we used the fact that we were saving even more money than the international organization to say, hey, look how great we Ukrainians are. We can even do better than Crown Agents and then UNDP can do, which really helped a lot for that. And just to tell you how successful it is, the person who headed up the medicine procurement agency is from Crimea, actually. He's a Tatar who was displaced in 2014. His name is Arsen Zhumadilov. And he's so successful that he now works at the Ministry of Defense and procures everything for the Ministry of Defense of Ukraine. So that just shows you how successful this program was.
I'm sorry, I just stay because you're part of the panel now. So we would like to maybe just one question. We started late, so please. Okay. Just one question, one or two questions. Yes, please.
The highest row.
Erica.
So that,
yes.
Get your exercise today.
Yeah.
I don't know if Jillian's still.
Thank you so much. My name is Eva Parvanova. I'm a PhD student at LSE, and I look at corruption in healthcare. So this was all really fascinating, and thank you all for your input. I wanted to ask, so Ina mentioned that a lot of the multilateral agencies that participated in procurement reform had actually embedded anti-corruption principles in their programs, in the sort of if I understood correctly, in the funding that they were providing to Ukraine. And I just wonder why this wasn't the case in other health programming as well, rather than just in procurement. And then just a very quick comment on civil society and patient organizations. I thought that was such a fascinating story. I studied patient organizations in the UK where, as in other high-income countries, they've actually become lobbyists for the pharmaceutical industry. So hearing that side of the story was just really fascinating. Yeah, thank you.
Thank you. So Ina, could you give a quick response, comment to that? Why was just these anti-corruption measures embedded in the procurement process, not in other areas of the health system reform?
Yeah, you mean that it was taken into the account that this is some principles of this transparency and of course we definitely understood at that time. We understood that with the help of this donors organization, which funded the technical support for government of Ukraine, the producing of this legal change, this law, and of course all these legal documents were produced with the support of this consulting, foreign consulting and the local consultants, with the also, of course, with the taking into the account all of these principles you have mentioned. And yes, I mentioned that also all public procurement in Ukraine, they should be carried out on the ProZorro market. Okay. ProZorro is an online platform which actually provides some digitalized platform for all some procurement agencies in Ukraine, not only in the medical sphere.
Not only in health, in other sectors.
Yes, in all sectors. And actually, the main goal of this procurement reform and the launch of state-owned enterprise was that medical procurement of Ukraine should provide the tenders for all manufacturers on this ProZorro e-platform. And actually, it's a basic principle that for the transparency, that everyone in Ukraine should have the access on tenders for the analytics, who participated, what manufactured, what kind of prices, etc. And yeah, it was a basic principle which was taken into account when we produced this law with the technical support of donors organizations. Yes, maybe Uliana also can mention something.
That's great. Just, I know that we've run out of time. I would like to ask everybody to say one thing that could be done to ensure resilience of all these reforms in your context. So maybe Gillian, we start with you. Can you say one recommendation, one thing that the international community or countries should do?
Yeah, prevention. So I'll speak generally. You need to have, in terms of procurement, you need to have systems in place before crises arrive.
Great. What's your headline, Martin?
You should never submit a freedom of information request and get the answer back from a public agency that they cannot answer because it is, quote, commercial in confidence, unquote. That should be completely unacceptable. And yet that is the routine in countries like this.
Right. One thing that could make this reform resilient.
Make sure that the politicians support it. Seriously, that's it.
Yes.
And when it comes to anti-corruption, actually very many aspects of the reform were anti-corruption aspects. The National Health Service of Ukraine has an online transparent program where you can follow every single hryvnia that's paid to every single hospital and every single primary care facility. That was something that was very important for people to see. And then the other things are safer in medical education. Before, you used to get into medical school because you knew somebody, or now it's based on what your grades were, what your standard testing is, and so on. So every aspect of the healthcare reform actually did have an anti-corruption portion put into it. And I think that there is a false name or naming of Ukraine as the most corrupt country in Europe because, as we've heard,
No.
Okay, maybe some countries are no longer in Europe, but they still have problems. Okay, so not the most corrupt in Europe. But the thing too is that something for you to understand that in Ukraine, everything is called korupция or corruption, whether it's fraud, whether it's price fixing, whether it's anything to white collar crimes, bribery, it's called corruption. So when Ukrainians come out and they talk about corruption, we all think they're talking about high level government officials, trying to make money off of something, but they're not. They're talking about, some doctor taking money under the table at a hospital. That's not exactly corruption. That's insurance fraud, right? So that's another thing, is to understand that corruption is not necessarily, the same thing in every single aspect.
That's great. Sure. And my final word is we can never be complacent, because we know from a lot of reforms, a lot of similar initiatives, having a technical system, everything is transparent, people find ways to game it. So I think constant vigilance, it's really important. Thank you very much for this. Really interesting. And please welcome our panel. Clap.
Thank you.
Thank you very much indeed. Wow, what an absolute treat. Talking about the politics of universal health reforms. And I just really want to pick up from where Ilana finished off about how do we get the politicians really buying into this? Because I think I'm certainly not going to try and summarize what we've been discussing this afternoon, but what's been speaker after speaker has been talking about is this is a highly political process, the primacy of politics, I think Pablo said. And just to sort of mention, when I was privileged to be part of the SAG, the group in 2014-15 in Ukraine, one of the international advisors, I think the analytical work that we'd done and what we presented was actually pretty obvious. It was so obvious, the overemphasis on hospitals, the complete lack of an effective primary healthcare system, and the monumental corruption in the pharmaceutical sector. And so what that group did was present the sort of bleeding obvious, really. But it was very noticeable, Ilana, that when we put it to one of your predecessors about tackling corruption in pharmaceutical, in a big public meeting, so I'm not sort of betraying any confidences here, he said, I am not going to do that because the mafia will kill me. I am not going to do that. And so it just seemed to sort of die there. And then you and your team showed the political leadership to actually take that on. And, you know, phenomenal bravery in doing that, and a great personal cost. It's very rare that happens. And, you know, that and when you at the launch of our commission last June were recounting your experiences, it was very noticeable. A lot of the tactics that you used were very similar to what Nye Bevan did in launching the NHS, you know, sort of reaching out directly to the population. And I think that when you put it to the population that they could register for family doctors, I think you told me about 20 million people registered almost instantaneously. This is what Nye Bevan did in sort of taking on the vested interest in the medical profession here to get people to register for a service that didn't initially exist. Spectacular political bravery to do that, and it worked. But I think so often we are not very good at talking the language of politics and advising people. And again, at our launch, you said that you joined our commission because you wished something like this had existed when you were Minister of Health, because I think what you were doing, perhaps intuitively, in engaging the population, there's not really a manual for this, you know, and you know, I think it's very, very important, as you're saying, to share these experiences with other countries to really talk about tactics. How does one take on vested interests? How do you tackle the corruption? How do you bring the population along with you? And it's one of the things our commission is trying to do, and recognize that so many of the world's great universal health systems have actually come out of crises. It's at times like this that you can do stuff like this. If you have got good technical teams, if you've got the Ministry of Finance coming in with the public financing, if you've got the head of state behind you, but then we need to be adopting different tactics in presenting this, you know, so we do emphasize the health benefits, the economic benefits, but also the societal benefits. And at least 2 or 3 of you mentioned it's nation building. This, you really can use it to build nations coming out of crises. And I think these are absolutely key lessons that, you know, you're sharing with us. But I think, you know, that we can share with other countries going through various crises. Well, the whole world's going through crises at the moment. So I think congratulations to what you and your team have achieved. And if there's anything that we can do collectively to put the word out there about what you're doing, but then share these lessons with other countries, I think that'd be a truly wonderful thing. So thank you very much indeed. Thank you.
There is a reception with drinks and some food in G90. I don't actually know where that is, but it's something that will follow you. There's also a few copies of the case study that Ina wrote on the decorruption of the pharmaceutical sector. Yes, Ulyana has printed some out, so if you're interested, please come and grab one and share it with your colleagues. Otherwise, thank you very much for coming, and see you at the reception.
Thank you very much.
Thanks, Martin.
Sorry.